We have seen some new developments concerning the Federal Trade Commission's stance on non-competes early this fall. On September 5, 2025, the FTC voted 3-1 to dismiss its appeals in the 5th and 11th Circuits, abandoning its efforts to enforce the nationwide ban on most non-compete clauses. This came a day after the FTC announced an enforcement action against Gateway Pet Memorial Services, the nation's largest pet cremation business, alleging that nearly 1,800 employees, from executives to hourly workers, were unlawfully bound by one-year nationwide non-compete agreements in violation of Section 5 of the Federal Trade Commission Act. As a result, employers should be aware that the FTC is now pivoting away from nationwide rulemaking and toward individual enforcement actions against overly restrictive or abusive non-compete provisions. Under Section 5 of the Federal Trade Commission Act, the agency may investigate and challenge non-competes it deems unjustified, overbroad, or otherwise unfair or anti-competitive. Although the FTC cannot award damages or create a private right of action, the FTC can send cease and desist orders and initiate court actions, possibly resulting in injunctive relief. Importantly, employers may also face risk if their staffing vendors impose unlawful restrictions and there is a joint employer relationship between the employer and staffing company. On September 10, 2025, the FTC chairman sent letters to several large healthcare employers and staffing firms, urging them to review their non-compete agreements and other restrictive covenants. The FTC warned that overly broad or unjustified restrictions on healthcare worker mobility could trigger enforcement action, especially in rural areas where healthcare access is already limited. The FTC raised concerns about non-competes commonly used in contracts for nurses, physicians, and other medical professionals, limiting their employment options and reducing patient choice. The agency stressed that such agreements can be particularly harmful in rural or underserved regions. The FTC encouraged all employers, not just those receiving letters, to ensure that employment restrictions are not overbroad and comply with the law. Employers should be aware that states like Arkansas, California, Colorado, North Dakota, Oklahoma, and Wyoming have already entirely banned or severely limited non-competes for physicians and other healthcare professionals, while other states like Maine, Maryland, Oregon, Rhode Island, Virginia, and Washington, D.C. impose income thresholds for healthcare workers to be bound by them. However, the FTC made clear through their actions in September that enforcement against unreasonable non-competes remains a top priority across the U.S. The FTC is also holding a non-compete workshop on October 8, 2025, which they say is part of an effort to highlight the negative impact of non-compete agreements on American workers and put businesses on notice of its enforcement priorities. As such, employers should also be on the lookout for more broadly sweeping actions outside of the healthcare space. Employers should take this opportunity to review and revise their employment agreements with non-compete provisions in order to comply with the FTC's guidance. For more information, please contact a member of our team and refer to Aiken's prior LaborSpeak discussions regarding non-compete.